we intend to give an overview of the subject of pharmacology. Pharmacon is a Latin word meaning herb. Herb is a plant, is a stemless plant. That's why in veterinary medicine we call animals that rely entirely on grass, we call them herbivores. Herbivores. So in fact the designation itself, the name herb, indicates the origin and source of drugs throughout the history of humanity. Anyway, the subject means, this subject, pharmacology, deals with drugs. And a drug is a substance, usually a chemical substance, that acts on living cells, physiologically or biochemically, to produce a desired effect. So it must be a living organism that the drug acts on, and the overall effect of that drug must be favorable, wanted, needed. That's why we teach the drugs to the students or health science students, be it medicals, veterinarians, pharmacists, or whoever is concerned in the health services, health sciences. We teach them the basic facts about drugs with a view to using these drugs in future if they become clinicians, for example, or pharmacists. So the first step about a drug, a chemical, which is a xenobiotic, means foreign substance, which is administered to a patient. The first thing is to teach the students the routes of administration of these drugs. How does a drug enter the tissues and the body of a patient? The main route, of course, we have the four main routes: ingestion, injection, inhalation, inunction. Ingestion means by mouth. Injection means you inject it either intravenously, intramuscularly, subcutaneously, intrathecally. There are very many routes through which you can administer drugs by injection. Inhalation means you take it through the respiratory tract. Inunction means you rub it on the skin. Of course, there is a problem here with the veterinarians, because most of the animals that they handle do not have their skin directly available to drugs. You have either to shave the hair or pluck the feathers, or whatever you have to do is to remove the outermost cover before you can rub the drug. This is not a recommended route in veterinary medicine. Also, drugs taken by mouth, there are various different compartments of the digestive system in animals. The digestive system in a bear is different from that of a cow, or of a cat, or of a dog. So we have to teach them how drugs can enter the body through which routes. Then, once the drug has gone into let's say, it's taken by mouth, which is the oral route, is the most common route. If a drug is taken by mouth, it has got to go through digestive processes, and then absorption from the gut, from the intestines, into the bloodstream, and then to be circulated. Of course, it doesn't get immediately from the stomach and intestines. Does not get to the blood immediately. It goes to the portal, through the portal vein to the liver. Ultimately, it has to cross membranes. It has to cross a membrane of the gut into the blood vessels, they have also membranes, and then wherever it is going to be delivered later on to where it should act, it has to cross membranes. Therefore, we have to deal with the processes and factors that may influence the crossing of a drug across a membrane. Luckily, all membranes are the same. All cell membranes of all structures and tissues are the same. Lipid sandwich. A sandwich of lipids. Inside the sandwich is proteins, all the cells. Therefore, but you have to teach the students the factors, physical factors and chemical factors that influence the crossing of a drug, either increasing its crossing or retarding its crossing. Okay, the drug has been taken by mouth. Well, where does it go now? It goes to the blood. From the blood, it goes to where it should act. Maybe it is desired to act on the central nervous system, or on the muscles, or anywhere. After it has done its effect, it has got to come back to the blood so that it can be broken down, biotransformed, and then taken outside the body, eliminated from the body. The main elimination site in the body, of course, as we all know, is the kidney. But in animals, the other, with milk, there's a route for elimination. The saliva is a route for elimination. The tears is a route for elimination. So this is called pharmacodynamics. I beg your pardon. It's called pharmacokinetics. This is the kinetics of a drug from point of administration to absorption to distribution, biotransformation, and elimination ultimately. But what does the drug do when it gets to where it should act? What is the mechanism? How does it bring about the desired effect? This is called pharmacokinetics, dynamics. Pharmacodynamics, dynamic, you know, as the word itself shows that there is a dynamic interplay between the tissues and the drug. And of course, then when it has been dealt with, when it has done its effect in the body, as we said earlier, it has to be eliminated. So the two major parts of pharmacology, introduction at the beginning, is pharmacodynamics and pharmacokinetics. Pharmacokinetics is what the body does to the drug. How does it handle it? Absorption, distribution, whatever. Pharmacodynamics is what the drug does to the body. What does it do when it gets there? And how is it get eliminated? It has to be eliminated. If a drug stays in the body, that will be a tragedy. Once it has done its effect, it has to be removed, gotten rid of from the body. So these are the two major components of the first part of pharmacology. But then, when this is the basic information. But then the drug itself, as we said, which is a chemical compound that plays a role in the biochemical and physiological processes of a living cell. It can be used, drugs can be used for the prevention of disease, for the diagnosis of disease, for treatment of disease, and in veterinary medicine, one of the most important uses of drugs is to increase the productivity of an animal. More kids, more calves, more chicks, more milk, greater fat. This all is an important aspect of the use of drugs in veterinary medicine. Of late, there is a new development in the use of drugs in veterinary medicine, and that's synchronization of estrus. That means that you bring all the female animals, childbearing or whatever bearing animals, you bring them all in estrus at the same time, and you fertilize them with artificial insemination. This is remarkable of these days in the production and increase of productivity. Because as we all know, that a female animal does not accept a male unless she is in estrus. That is, she is ready to receive the animal. And this estrus is induced by hormones. Nowadays, there are new drugs called prostaglandins, which can make the animals come into estrus at the same time. Almost all the herd, all the childbearing females the child is calf-bearing or lamb-bearing animals in the flock. This is important because now you can manipulate the whole herd so that all the animals will deliver at the same. We know the gestation period, the length of bearing of all different animals. So you plan to have them all pregnant at the same time and delivering at the same time, and of course you can utilize it in milk production. You say to hospitals or to an army camp that we will give you milk, that much milk during the period from March to June, because you know that almost you have already given into consideration the pregnancy, length of pregnancy of cattle, for example, 9 months. You give them 9 months before March, so that they will all deliver in March, and you know that from March to June or July, you have maximum productivity of milk. This is, you can use this for international trade. This is very important use of drugs nowadays in veterinary medicine, particularly prostaglandins. And one of the most important things to bear in mind in use of drugs is the sociological problem of drug abuse. And this is a great problem in society, in human society. We don't suffer from this in the animal world, but some of the drugs that are used, as I just told you about prostaglandins, used for improvement of productivity, they can also cause abortion in humans. And you can imagine the implications of this. Safe abortion, no bleeding, no nothing, no side effects. Of course, here there is a moral obligation for veterinarians not to avail these drugs to human patients or subjects, because they can be misused. And of course, all of us, so whether veterinarians or pharmacists or medicals or agriculturists or engineers, all of us we have direct our attention to the welfare of humanity generally. If our profession does not lend welfare aspects to humanity, we have to check and ask this question again to ourselves. Therefore, we have to bear in mind, I say this to all veterinarians who can lay hands on these drugs, not to let them leak to be misused in human hands. And we'll meet again.